Hello everybody, my name is Lisa Keegan. I'm a PhD candidate at Griffith University in Australia. I'd like to talk to you today about providers' views about governance and leadership in long day care and how this impacts on the quality of early childhood education and care provision for children. I acknowledge the people who are the traditional custodians of the lands on which we meet today and pay my respect to the elders past and present and extend that respect to Aboriginal and Torres Strait Islander peoples and other Indigenous peoples around the world. My research aim was to look at, in the views of providers, what they felt was sustainable and unsustainable in practices happening within long day care services, in particular their own services, in Queensland in Australia. So I looked at Southeast Queensland services, which encompassed the Sunshine Coast, Brisbane and the Gold Coast. So why is that important to know? Well, the quality of relationships, environments and experiences a child engages in during the early years affects their lifelong learning trajectory. A future society that's populated by higher order thinkers, problem solvers, good decision makers, creative thinkers and socially and emotionally well-functioning adults requires children to have positive early childhood relationships and experiences, including access to quality early childhood education and care during the peak brain development age of 0 to 5 years. In the words of David Bowie, tomorrow belongs to those who can hear it coming. So what happens today for these young children affects what happens in the future, not just for those children, but for all of society. So if we want decision makers that are going to make good decisions for our communities and for our society as a whole, we need those decision makers to have had that good brain development that starts in their early years, because that continues through until they are of adult age. There is currently limited information about providers' perspectives of their governance and leadership role in long day care provision and how that impacts sustainable quality long day care. In contrast, there's an awful lot of information at a service level, so looking at nominated supervisors, which used to be called directors or managers, and educational leaders' governance and leadership in services, but very little research exists around the views of providers. So how did I go about finding all this information? Well, I did semi-structured interviews, 9 interviews in total, which encompassed 12 for-profit services in Southeast Queensland. All of those services were meeting, exceeding or excelling the quality standards. So the questions that I asked were linked to sustainable practice frameworks of chemists and national quality standards. Each of the interviews took approximately 2 hours. It's also important to note that I have insider perspective. I worked in the field of long day care in both for-profit and not-for-profit services for 27 years before undertaking a career in research. Therefore, I come with my own biases and my own experience, and therefore how this data is analysed is certainly affected by that. My research questions encompassed an overarching question, which was how does provider governance and leadership affect sustainable quality long day care provision in long day care in Southeast Queensland? My sub-questions were, what are the practice and practice architectures that impact providers' sustainable governance and leadership in long day care in Southeast Queensland? And how are the elements and key phrases of the National Quality Standard and National Quality Framework, governance and leadership, deemed by providers as sustainable and unsustainable in practice? Looking at the sustainable practice framework and the practice architecture, it's important to note that practice architectures prefigure the practice, that socially created cooperative human activity occurs, and that practice requires a clear aim. So why are we doing the practice? Which comes into the sayings of why are we doing it in the first place? What's the theory? What's the legislation? What's important to know about children and families that governs what we do. Secondly, there needs an actioning of practice. So how are we doing this practice? And so that comes to the doings, which is all about implementing practice in the service. And what does that look like? Thirdly, we're looking at a focus on outcomes. So what are we actually achieving? And that comes back to the relatings. And so when we have a look at the top of this slide, you can see that sayings, which are the practice architecture, relate to cultural discursive information. And that includes things like language, how people encounter each other, how things are communicated in the service, what knowledge do people have, how is that shared, all of those sorts of important professional traits that need to occur for quality practice to occur. The doings in the next column show that links to ecological material and economic practice. So the activity or the work in a physical space. So how do people encounter each other? How does it all work? What practices are put in place that reflect the sayings? Then we have relatings. And relatings are about social, political and moral and personal practices. And so that looks at things like what power hierarchies exist in a service. How do people know what it is they need to be doing each day? Who's in charge? Who's, those sorts of things which are really important to know when you're in a workspace. So practice may follow already established patterns, and they can vary by circumstance. So each service had different ways of doing things and, different hierarchies and, different understandings about things, and that people adjust to practice to meet the practice architecture. So when you're looking at the sayings that are happening, those things start to change as practice changes. So it's really important to know that changes can be made which will then impact the overall sustainability of a service. It's also interesting to note that these elements here fit in with elements around what research says is good organisational structure. My findings show that there are a number of sustainable and unsustainable practices that occur in long day care services, specifically the services that I interviewed. Sustainable practices encompassed the sayings and discursive practice and moral and social practice. And so they were things like knowledge of legislation, knowledge of theory that relates to good practice, inclusion, moral and social, encompasses inclusion, focusing on children, focusing on families, ensuring that staff are supported, those sort of practices that lead to quality. Unsustainable practices were related to the doings and also relatings. So again, in a different context, relatings also cross over into this area. And they were to do with economic, ecological material and personal practice. And a lot of those things were economically, the providers felt that the funding was insufficient to meet quality standards, and that even though they were for-profit services, they weren't really making profit. They were drawing a wage, and then any extra money left over was going back into the service to improve its quality. Ecologically and materially was about how that hierarchy all exists in the service. How does it all work and come into play? Are people, being given sufficient support and knowledge and training and professional development and those sorts of things to maintain the ecology of the service? And so that I looked at materially with things like resources and the spacing and that sort of stuff within a service. But ecologically, I looked at that from a human services perspective as well. So what was happening for staff, what was happening for providers in that ecology of the people in the place, not just the physical environment. And personal, certainly encompassed the workload and stress levels that people were feeling as a result of their role in long day care. And, some felt that it was too much, and two of the providers I interviewed had indicated that they would not continue in that role because of the impact it was having on their own health as well as, their families. So it's very important to understand why these things were seen as unsustainable or sustainable. So quality is defined in long day care in Australia by the National Quality Standard, which was introduced by the federal government in 2012. There's a set of 7 quality standards that services need to comply with, and they're assessed against those standards and given a rating. So the ratings for services can be excellent, exceeding, meeting, working towards, or significant improvement required. The services I interviewed were either excellent, exceeding, or meeting. Standard 7, governance and leadership, wasn't my focus for this study, and you can see to the left of the slide the expectations there. So standard 7.1 is governance, and it has 3 elements attached to that, and standard 7.2 is leadership, and again 3 elements are attached to that. That is broken down in the National Quality, the Guide to the National Quality Framework, which gives a lot of information about what that actually looks like in practice. And it was phrases from those documents, both the standards and the National Quality Standard and the National Quality Framework, that I used to analyse the transcripts. What I found from that analysis was there were substantially more areas where providers felt those practices were sustainable than they were unsustainable, but the effect of those unsustainable practices resonated very strongly with those providers. So sustainably wise, looking at, again, key phrases out of the National Quality Framework and the National Quality Standards were the importance of critically reflecting on practice, continuously improving their practice, looking at what they're doing, is it working or is it not, and what do we need to improve. Professional development of staff as well as providers was really, really important to stay up to date, current knowledge, current theories, and to, extend their own professional capacity. Mentorship was seen as very, very important. Again, being able to spend time with their staff and role model to them what should and shouldn't be happening. The focus on children was very, very important. That they felt that even though legislation suggests that the focus is on children's development, but also workforce participation for families, that had implications in itself, and for them that focus on the child became more important than any of those other agendas. The training and qualifications and competence of the provider was very important to the quality. So all of the providers that I interviewed were early childhood qualified. They had experience in long day care before they became providers of their own services. And that was very, very important to quality because they knew the legislation, they knew the frameworks, they knew about good theory, they were well trained. Relationship building was obviously important, and that was not just between the provider and their staff, but between the provider and the governing bodies that oversee what the practice in quality childcare centres. Networking, again, was seen as very important to be able to gain new knowledge, to share that knowledge with other services, and to have knowledge gained from being around people with their own services as well. Legislative and theoretical knowledge again comes back to that training and qualifications. These providers had a very strong knowledge of what the legislation says, what it expects, what theory relates to early childhood development, and even though different services were doing things differently or may have run under different theory, it still was quality, and so that shows that it can be done in various ways. And so there's no one model fits everybody, and what they were doing was clearly related to their community and, you know, what they felt was important for the children and families in that community. And so that family and community discourse was really, really important too. And communication, how they communicate, how they dealt with conflict, how they, you know, were able to make it clear what expectations were in the service for quality, and, you know, to share that with families as well. So unsustainable practices were things like the time and workload expected from that legislation, and the stress that placed on providers. They felt that there was a lot of overlap and a lot of inconsistencies between the different legislations. But it was also about how that time and workload impacts their personal life, because they were taking so much work home, doing things late into the evening and on the weekends and things, and even bringing their family into the centre on the weekends to get things done in order to meet that quality. The governmental legislative efficacy, again, was important. And that was feeling that even though most of the documentation was pretty clear, the process of being assessed against all of that wasn't always clear. They felt that there was an element of bias in the, you know, the assessors were not necessarily objective in what they were looking at based on what their own personal views and theories were around child development. They also felt that there was a lack of support, a lack of mentoring. They felt that it was a compliance process where we come in, we look at what you're doing, see if you're doing the wrong thing, slap you on the wrist if you are, and then we go away. And they felt that that was not supportive. They felt that if quality is the aim of the standards, then the government processes for that should be about mentoring services, assisting services to get to that level of quality, rather than just saying you didn't do that correctly. Economically, they felt there was insufficient funding to provide quality, that to meet all the expectations of the legislation cost a lot of money. The legislations have been increasing, the expectations on services have been increasing, but the funding hasn't matched that. And so, you know, they found it very, very difficult economically, particularly services that were in a lower economic area where they were limited in what they could charge in fees to parents to make it affordable for parents. Health and wellbeing relates back to time and workload. The workload, having to take all that home, affected them. It affected their health, it affected their well-being and that of their families. They also felt quality was an issue in some services. They felt that in their own services and, you know, people that they knew within the sector were sitting at that space of quality, but there were a lot of other services that weren't. A lot of services where providers are not on site, they don't have any qualifications. Some of them, you know, are from overseas, so they're not here to see what's going on, and that certainly impacted the quality in other services. Conversations that they'd had at networking meetings and things like that, where other providers were talking about the sort of practices they do, suggested to them that there was a lack of quality in some services. The training and qualifications and competence of staff came back to the quality of the curriculums under which they're taught. They felt that they have been watered down over the years and that it doesn't have the quality and the knowledge embedded in it that it used to do. And so staff are coming out with a lack of tools and a capability to actually hands-on provide quality practice. So this all comes together in the correlated findings. So the chart on the left is the sustainable practice and practice architectures and how they link over to the phrases and the elements from the National Quality Standard. And the chart on the right shows the unsustainable practice and practice architecture that relates to, again, the National Quality Standard and National Quality Framework. So again, things that we talked about in the previous slide, but what it shows is when you link it over to chemist's practice and the practice architecture, you can see on the left slide Discursive, which is all about the knowledge and the understanding of legislation and theory and child focus and quality practice, sits highly in that sustainable practice. And the moral social, which is about inclusion, including families, including children, making sure that staff are supported, making sure that there is sufficient resources provided for staff to be able to do the job that they need to do, and all of those things. So the moral, social and discursive practices were sustainable. When we look at the unsustainable practice, the ecological, material, personal and economic practices were predominantly unsustainable. And that was things like, again, the time and the workload and, how that was affecting them personally, how the ecology, the human services component of a service was working, and obviously the funding, again, the health and wellbeing affecting personal practice, quality discourse, and the training calls that we talked about. So from all of that, I developed a list of recommendations that I felt was important in order to improve the quality in services, and therefore the childhood experiences that children have, which then affects their brain development, which then affects their lifelong trajectory. So the first thing is to do larger scale research to determine if the scope of these findings exists across a broader range of long daycare services or childcare generally, because obviously this was a small scale project, and whilst it gives certain information, it can't be transferable across every service. So streamlining the governmental and legislative processes, so improving that consistency in the legislation and the assessment and compliance processes, so removing that subjectivity and the personal interpretation of those ratings, reducing the overlap across legislation to decrease workload, increase funding, which with requirements for an audit. At the moment, certain funding that comes into long daycare services are audited by the government to ensure those taxpayer dollars are used where they're meant to be used, but other aspects of the funding is not. Introducing mentoring in lieu of compliance, changing or increasing the funding so that more professional development can occur for providers as well as staff, improving the training and qualifications of providers so that they have a better understanding of why they're doing what they're doing, and that obviously increases quality. And introduction of a wages subsidy, certainly, the wages that are being earned by providers is limited, and that can affect turnover and the amount of staff that move on from the sector itself, and that includes providers. So, one provider said to me, well, you can only stay in this for so long, but when you realise that you're not making money, then centres are going to close, and that's going to then impact workforce participation, and it's going to impact, brain development for young children. So introducing strategies and support for improving mental health and wellbeing of providers is really, really important. If we don't look after them, they're going to leave the sector, and we're going to have reduced accessibility and affordability for families. So thank you very much for listening. I hope that has given you a little taste of my research and my findings. I hope you enjoy the rest of the presentations today, and thank you so much for listening.